Hi, I'm Benjamin James, freelance research officer at Pathfinder's Neuromuscular Alliance, and I'm going to provide a brief summary of some exciting research we have been involved with focusing on social care. When it comes to support, there is often a heavy focus on healthcare needs with limited attention to social care. That's the message often received by those attempting to interact with a social care system that, in many cases, does not always support people to be fully independent, make choices, or have control to live a meaningful and fulfilling life. Despite the social care needs being well known in the neuromuscular community, research highlighting this can be hard to find. In a comprehensive review by Peat et al., a long-term supporter of Pathfinder's Neuromuscular Alliance, and our very own Dr. Suzanne Glover, Research Manager at Pathfinder's Neuromuscular Alliance, titled Social Care and Young Adults with Neuromuscular Conditions Diagnosed in Childhood, a co-produced review gathered evidence about social care and young adults with neuromuscular conditions. This aimed to identify gaps in evidence by reviewing existing literature on neuromuscular conditions and social care to understand the ways adult social care is discussed and accessed. 3,000 references from 25 different international studies were analysed with varied quality and availability of information around social care for young adults with neuromuscular conditions. Some of the examples of the themes identified in the research included informal care, care provided by relatives and non-professionals, personal assistance, externally sourced care, and interaction with the social care system, obtaining support and information. So, what were the main findings of this research? The main findings were that the quality and availability of adult social care is considerably lacking, and how these studies were conducted and reported their findings often lacked the voice of the neuromuscular community. Other important findings included that acquiring social care became harder when the adult with a neuromuscular condition entered adult social services in a period known as transition. Young adults also reported loneliness, isolation, and difficulty establishing and maintaining relationships due to inadequate and poorly funded social care. So, how does this research have relevance for the neuromuscular community? Why does this research matter? This review has value to the neuromuscular community as it validates communities like ours with neuromuscular conditions and disabilities being at the centre of social care reform, nothing about us without us, informed by evidence that engages with the community and outlines which parts of the social care system are most important to young adults with neuromuscular conditions and how they are currently being let down. An important part of this research was that it was co-produced alongside a group of 5 young adults living with neuromuscular conditions. Co-production is a key aspect of the work of Pathfinder's Neuromuscular Alliance research. By involving young adults with neuromuscular conditions as co-researchers in this review, the researchers were able to focus on the issues which really matter to the community, despite the lack of evidence. So what are the conclusions, and what are Pathfinder's Neuromuscular Alliance doing about this? These findings have helped set an agenda for further collaborative and fairer research into adult social care. In partnership with Pathfinder's Neuromuscular Alliance and the University of Northumbria, our current National Institute of Healthcare Research funded project, Enhancing Social Care for Young Adults with Neuromuscular Conditions as a Preventative Approach, a co-produced, experience-based, co-design research study, seeks to challenge common cited tensions between the provision and delivery of adult social care. Using research methods that challenge traditional ways of conducting research, the research team involved expressed a desire to challenge a dominant health narrative where social care is sidelined in favour of medical research. They want to highlight social care as a crucial component of life for people with neuromuscular conditions. So in conclusion, researchers found that across a variety of studies, the availability, quality, and discussion of social care is poor. However, this can be changed by working with young adults with neuromuscular conditions to create further co-produced research. We hope you enjoyed this research summary, and we look forward to bringing you more in the future.